Let's learn about other mechanism of labor: restitution, external rotation, and at last but not the least, expulsion, or you can say birth of shoulders and trunk. Okay, so what we have learned in previous lecture about extension. Okay, now we have seen that in extension a successfully part of vertex, brow and face are delivered. Okay, so what happened next? Now one by its cervical ring comes into opposite direction, because as I have explained you before, a ball cannot glide, means fetal head cannot glide directly, it has to be come in a rotate motion. Okay, so in this, as you can see, head is born by extension, and then what happen next? Head drops down with the face close to anus in next part. So what should be done? On other right hand, we have to push a pressure downwardly, as we have to support on which side? Mandible part, chin. Okay, and other than opposite, we have to push pressure upwardly. Okay, that's how neutralize balance. And then now a crowning happen. In this time, crowning happen, like successfully presenting part, vertex, brow and face are successfully delivered. And now what happened? Delivery of shoulder and trunk. For that, head needs to move on opposite direction. Why? Because laterally bended flex shoulder needs to come out. So a head on opposite side on 1/8 part restitute. Okay, what happened? Restitution, it is the visible passive movement. Why passive movement? Because it lead by shoulder, so it is a visible passive movement. Why passive movement? Because head is already delivered, vertex part, brow and facial part. It is a visible passive movement of the head due to untwisting of neck. Not neck cannot be twisted. Why? Because it already comes in between this gap. Okay, this vaginal gap. What happens? Shoulder are pushing towards external environment. So neck sustained during internal rotation, but movement of restitution occurs rotating the head through 1/8 of a circle in direct opposite. If it's on left side, then moves in right side, and if it's in the right side, then move on left side. So direction opposite to that of internal rotation, the occiput. Okay, this side parietal part, this occiput part. So that occiput part, posterior side. Okay, the occiput part points on maternal thigh, in between thigh part. Okay, this part, this one side. Okay, this thigh part between. Okay, maternal thigh of the corresponding side to which originally lie. Okay, after restitution, okay, what happened? External rotation. Now that twisting of head accurately comes 100%, 50%, 100% restitution done by external rotation, and then easily delivery of shoulders and anterior shoulder and posterior shoulder. After that, complete trunk delivery happen. External rotation, it is a movement of head visible externally due to internal rotation of shoulder, as you can see. Okay, as the anterior shoulder rotates towards the symphysis of pubis, this part, symphysis of pubis, anterior side. Okay, from oblique diameter, this side. on crossword side. Okay, oblique diameter. It carries the head in a movement of external rotation through 1/8 of a circle in same direction. Okay, once head restitute on opposite side, now it can be delivered in that same direction. Now there is no rotation of head happen. Okay, so the shoulder now lie in anterior posterior diameter. The occiput points directly towards the maternal thigh corresponding to the side which it was originally directed at the time of engagement. Now the previous position automatically happen for ease of delivery. And at last, expulsion, birth of shoulder and trunk. After shoulder are positioned in anterior posterior diameter of the outlet, means pelvic floor, further descent take place, bending, and the anterior shoulder escape. First, anterior shoulder escape below the symphysis of pubis by the movement of lateral flexion. This side on posterior side, lateral flexion on both sides, lateral flexion, spine literally bend, and at that time coccygeal part moves into 0 to 180 degree for ease of delivery. So by the movement of lateral flexion of spine, that's essential quality of maternal pelvis that cannot be possible in other kind of pelvis, that gynecoid pelvis specifically. Okay, there are so many types of maternal pelvis, but for accurate normal vaginal delivery, gynecoid pelvis means maternal pelvis is ideal. The posterior shoulder keeps over the perineum floor. Now what is perineum floor? As you can see, this is anal opening and vulva part. Okay, anal opening, vulva part, labia majora, labia minora. Now both labia minora end, which is called as fourchette. Now this fourchette and anus have distance. This is called perineum. So at the perineum side, okay, so posterior shoulder sweeps over the perineum. At that time perineum rupture can be happen, injury can be happen if in most of primigravida or primipara, perineum and elasticity are so tight that posterior shoulder head delivery, anterior shoulder delivery are tough to deliver. So sometimes or the most of the time perineotomy or episiotomy happen. If you want to learn about perineotomy and episiotomy, you can comment. And now rest of the trunk is then expelled out by lateral flexion. So here our mechanism of labor is complete. If you have any doubt, you can comment. Till then, happy learning.